these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office, experts on what they're talking about.
This is the podcast
For insights into the issues.
China, bioterrorism, Medicare for all, in-depth discussions.
Breaking it down into simple terms. We hold
these truths.
We hold these truths.
with Dan Crenshaw.
The Eagle has landed.
Dr. Bob Kadlec, thank you so much for coming back on the podcast. It's been a while.
It has, and it's great to be back. Thank you very much, sir.
So, we've talked about pandemics and zombie apocalypses and all the like in the past. And of course, we had something of a global pandemic with COVID. Just to remind our viewers, you're former Assistant Secretary of HHS for Preparedness and Response, otherwise known as ASPR. And so a lot of expertise on these subjects, and more recently, a senior advisor to Senator Burr during the COVID origins investigation. So we want to talk about COVID origins because most of the pandemic, anybody who raised any questions about the origins, being coming from a lab, for some reason was dismissed as some crazy conspiracy theorist, which it was just such it's a very reasonable theory. I don't care how you look at this. But the New York Times called it a fringe theory. Washington Post called it a conspiracy theory. CNN called it something out of a comic book. It was pretty intense for a while. But eventually I think more and more data came out, more and more facts came out, and it became less and less of a fringe theory. So here we are. It seems like it's now the overwhelming primary theory is that it is a lab leak. There's a lot of questions still surrounding that, intentional lab leak, accidental lab leak, cover up that occurred with China. So let's just start there. I mean, what did you find in your investigation with the Senate that maybe you didn't think you would?
Well, first thing of all is that we looked at both possibilities. So we didn't exclude one being a zoonotic or animal source outbreak over a laboratory one. We said, hey, let's do an A and B team kind of an evaluation. And I had enough people on my team where I had two lawyers, one leading each team, and that always brought a little entertainment, having two lawyers fight over their respective positions. It's like two scorpions in a bottle. But I think the key thing is we looked at both and we tried to evaluate what was the evidence for either or, and then kind of compare the two. And that's kind of how we came to a conclusion.
And so who's we? How many? When did this start? When did this?
So it started formally in June of 2021.
Okay.
It ended basically in January of 2023. So you can figure out the months, almost 2 years, literally.
Yeah.
It was like dog years, regardless. And what we were able to do was really kind of determine that on one hand, there are very well established criteria for what would conform with an animal associated outbreak.
Mm-hmm.
And then there are certain things that do conform with what would happen to a laboratory associated outbreak. And we were able to populate the facts into each of those categories and come up with a conclusion.
And the conclusion is
it favors that elaborate preponderance of circumstantial evidence favors a laboratory accidental release.
Mm-hmm.
One of the interesting things is
it wouldn't hold up in court. It's not like beyond a reasonable doubt, but it's a pretty good preponderance of evidence.
Well, I think if you were to, and we did argue it in the case of a legal circumstance, is that there is a lot of evidence on one hand about a laboratory event and virtually none for an animal related event.
Yeah.
And so if you look at that and taking that to court,
that's true. If you have to choose,
you would basically side with, hey, there's a preponderance evidence.
Right.
I think what makes it even more compelling is regardless of where you come down on it, if you look at the events of the outbreak itself, meaning is when do we think it started and about what time frame, and look at a variety of evidence around that, which is what we call epidemiological evidence, medically derived evidence, you find that the outbreak occurred late October, early November. And by the way, that coincides with a lot of the events that we ascribe to a laboratory associated incident.
Yeah. I don't want to get into what those are exactly. why are we having this conversation now? Something was in the news recently about this. I thought,
Well, Alina Chan had written a New York Times Sunday op-ed piece that was fairly extensive, saying, and she had been on the fence for the longest time. In fact, read our report, and I think in some ways that persuaded her that it was.
Was it a bipartisan group?
It was originally. And the interesting thing that happened in our bipartisan effort is we ran out of Democrats because they all went to the administration. So where we started off with 3 or 4 on the team, and where they were, again, committed to a bipartisan outcome, and we kept them informed, by the late summer of 2022, those people had left.
I see.
And so we were left with, and that was one of the challenges, getting a bipartisan report out when there are no more bipartisan.
But the official report is technically bipartisan.
Yeah, the contents of it haven't changed significantly, even though it was.
But there's like a Democrat senator's name on it.
Well, no, it isn't in that case. Hattie Murray, who had her name to it and ascribed to it and supported it, in the end did not support it as the fact that she didn't have a staff that kind of reviewed it.
Yeah, I could vet it for her. Okay.
Yeah.
Great excuse.
Yeah.
So, does that mean we still don't have really this consensus, or what's your take from Democrats? It's not a hot topic here anymore. So I haven't heard from them on a while.
Well, I just think there's a lot of, there are a lot of antipathy towards it. In the times I've tried to raise it to people in terms of briefing, more of an update that has occurred recently because there are some new developments.
It's like they take it personally for some reason. I've never understood the antipathy towards the lab leak theory. Like, in what way does it incriminate you? Right? Like, why are you against it? Like, why was this automatic reaction? It was so strange.
In some ways,
isn't Dr. Fauci also? Yeah. And it was like, why? Like, why is it so stupid? Why do you care? I mean, we're not saying it's your lab. Like, what is the problem here? I think were they defensive about it because of the accusations about gain of function research and all that? You think, but I felt like that came later.
Well, I think so, but I think part of this is that the greatest guardians of Fauci besides himself is the Democratic Party on this occasion. And so I think that in some ways they viewed it, any discussion about this would somehow bring up the Fauci connection and whatever. But this is bigger than Fauci, right? Yeah. But it's even bigger than that, because in some ways, even though those things are relevant, the question is how related they are and whether they're ascribed to the events that happened, which seem to be associated with the People's Liberation Army, less so the WIV. I mean, yes, the location was the WIV, but it appears that the researchers involved in some of this work were PLA.
Yeah.
And so that's
let's go down that rabbit hole for a second, because it is a little suspicious how COVID worked.
Right.
Leaves young people alone, very contagious, kills old people. I think I got it right. I mean, that's the basic. Kills fat people. Kills people with pre-existing conditions and old people. And if we consider age a pre-existing condition. So, if you're China, like, what are the chances that they wanted to design something like this, even for themselves? That's getting real crazy. I admit that. But if you've got the Chinese demographics that you've got with an aging population, it's going to destroy your economy in the next decade or so. I don't know. That's kind of coincidental.
It is, but there are other coincidences that are worth kind of noting, which is back in 2005 and 6, a colonel by the name of Wei Lei, or Jay Lei, excuse me, Gao, published a paper in Army Review, U.S. Army University Press, that talked about taking advantage of biotechnology. And that he followed up with another article in Military Medicine, the Joint Special Operations Medical Journal, U.S., and talked about how they could achieve merciful conquest by harnessing the effects of biotechnology.
Yeah. And you could argue this would sort of fall into that category. And of course, the counter argument with what I just said, maybe they never wanted to use it on themselves because, well, they took on a zero COVID strategy. So I think the proof is in the pudding. They definitely didn't want it spreading in China. They lied right from the get-go about the disease. They stopped allowing domestic flights, but allowed international flights. So we we know that they knew and that they hid it, that there's a cover up. Is that part of your report about what the
It
Chinese
certainly
did?
implies that. I mean, the thing is that when you follow that trajectory going from 05, 06 to 2010, 2015, 2016, this becomes kind of like a central theme in some of their military doctrinal writing,
Mm-hmm.
which is about how can they achieve cognitive dominance through biology.
Yeah.
And that kind of intersection is kind of interesting insofar as some of the researchers that were involved in some of this early SARS-CoV-2 research were not just microbiologists or virologists or vaccinologists. They were neurocognitive scientists associated with the Academy of Military and Medical Sciences. It's in particular the Institute of Military Cognition and Brain Science. That sounds pretty ominous, doesn't it?
But yeah, so what does that mean though? Like,
The whole point
what do you
is
think they were
that,
trying to do with that kind of expertise?
well, it gets to one of the first patents to the SARS-CoV-2 vaccine, which happens to be submitted by a PLA general from the Academy of Military and Medical Sciences, who's a well-established vaccinologist. He makes vaccines for a living. He made coronavirus vaccines for SARS-1, MERS, which is the one in camels, and then coincidentally was working on a SARS-2 vaccine very early in the pandemic. And the patent included 2 neurocognitive scientists. And some of the earliest animal studies had neurocognitive scientists. And so what that implies, at least, is that for some reason they were testing animals who were exposed to SARS-CoV-2, and they're giving them a vaccine and likely trying to figure out whether or not that vaccine protected against the brain effects of SARS-CoV-2.
Yeah, because there are strange brain effects. That's why I can't smell.
Right.
Still, 4 years later.
And here's the point. You early said that, hey, it seems to have not affected the young. Well, what's now becoming apparent is that young people were affected as well.
Oh, how so?
Well, they had mild disease, but many of them had neurological consequences,
Interesting.
which gets to the idea is, hey,
Has there been is there a study on this?
oh
that-
yeah,
like,
there's a number of things.
What
Steve.
kind of neurological? Or,
Well, let's first just say what's the number of young people that seem to be affected. The American Academy of Pediatrics in January of this year published a study that said about 6 million children have long COVID. And long COVID includes a variety of things, fatigue. It includes a bunch of neurological symptoms, challenges with memory, executive functioning.
how can they? I mean, isn't that kind of a hard thing to assess though? Especially with a child, a lot changes in a few years. So
Sure.
when it comes to cognitive
Well,
issues and
sure.
like sense of smell, like I've got,
Yeah.
that was 1000% COVID. It was,
But let's
slightly better over time, but it's actually kind of nice. I smell good things. I don't smell bad things. But it's actually quite
Forget
nice.
some dirty socks, right?
Yeah.
No, I was just going to say that, well, let's put children aside for a moment and then look at veterans. We're veterans, right? And the U.S. Department of Veterans Affairs did a 2-year longitudinal study in veterans who got COVID and looked at 2 groups. Those were hospitalized, obviously it's severe disease. Those who are not hospitalized.
So with the children's studies, they did a control group as well.
No,
I'm
here's the
assuming,
dilemma. That's the dilemma that we have.
That's the problem.
right
It's
now.
like, how do you, there's so many factors that lead to
Correct.
cognitive issues, memory
Yeah.
issues, fatigue. I mean, come on.
Yeah, but I will comment on a Norwegian study that had better controls for kids, just to
Yeah.
give you an example.
Yeah.
But for adults and veterans, 20% of veterans who had COVID did not get hospitalized, and 25% of veterans who got hospitalized had a persistent neurocognitive defect 2 years after their initial
Really?
illness. So the thing is that at least in veterans, it appears they had a neurological insult.
Jeez.
The same seems to be true for children, at least, and I just quote the Norwegian study, and the duration of the follow-up hasn't been as long, at least published,
Yeah.
is that 35% of kids over 16 who got COVID had some persistent neurocognitive defect, at least 4 months after.
So what are some examples of a neurocognitive defect?
Again, it's memory.
Yeah.
So a better example is what one of the Chinese researchers who was on the patent, who did these studies with the Brigadier General with SARS-CoV-2 looking at animals, published a study looking at UK data, looking at UK children, and found or determined that their lower intelligence as a consequence of
Wow.
during the pandemic
Yeah.
was not associated with not going to school, but was associated with their having COVID infection.
Okay.
And so what it
And
implies,
they did the right controls to assess that, because again, I have a lot of questions about
right? And so the thing is,
design of the study there, but
yeah, it
but
was
you could in theory control for that, because you have the same people who didn't go to school, and then you test the right kids.
correct. And again, the British had better longitudinal study in that
Yeah.
study. In that,
So that's kind of frightening. And you think there's, what's interesting, so let's tie a few things you've said together. So you have this really crappy disease. And then you have evidence from the PLA and their writings and their strategic doctrine,
aspiration.
talking about things like this going back to the early 2000s. The desire or the potential to use weapons like this. And so,
And then when you get in the middle there, from about 2016 on, is some interesting research that they were doing. For example, this should get everybody's blood a little bit boiling, is that the Fourth Military University, which seems to be an epicenter of expertise in this area of cognitive study or research.
Fourth Military University.
Fourth Military.
That's a Chinese naval or military academy?
It's a medical academy, a medical university. I think it's Jiangshen. I'm sorry, my Chinese is a little off.
Yeah.
But the point here is that they were doing collaborative research on a particular part of the brain with the Broad Institute, their Center of Neuropsychiatry in Boston. It's a very prestigious organization.
Mm-hmm.
But here there were 6 researchers from the PLA involved and wrote a paper in 2019 that actually looked at a part of the brain that's central in neurocognitive function. And so the thing is, you could at least ascribe that there's aspiration, there's active research. This association of neurocognitive scientists is kind of an odd thing. Anybody who I've talked to, doctor friends, infectious disease specialists, people who've made vaccines, seem that this is a little something that you wouldn't expect.
Yeah. Yeah. This is one of those places where the conspiracies have too often proven a little bit right. Let's talk about the actual argument. So let's say you're having that argument with somebody who still believes that it's zoological origins. I don't know who that person is at this point. Are they out there? I mean, so I have it in my notes here. Recently, we had a group of U.S. scientists reference data from the Chinese CDC that some are pointing to as evidence for the natural origin theory. So what's up with that? And then based on your long investigation into this, so give us the facts in layman's terms as best you can, why this theory doesn't make sense and this one at least makes sense.
Well, there are 4 principal characteristics that seem to be found in coronavirus animal outbreaks. And so this is from 2003 and 4 and 2012, when there was an outbreak in palm civets identified in 2003 and 4, and then one with camels in the Middle East. So typically what you see as examples of this is that you find animals that actually are harboring the virus.
Mm-hmm.
And these animals are carriers, they're intermediate hosts, and you can link that intermediate host with human exposure, meaning people got sick.
Mm-hmm.
And more specifically, you can actually link the genetics of that virus that came from that animal to humans. And so typically what you'll find is that the virus is adapted to that animal, and then the human is exposed, gets sick, and the virus that's isolated from that looks almost identical to that seen in the animal.
Yeah.
So that's one thing. The second thing is that typically you find some evidence of, let's say, in this case, a bat or a penguin that would be associated with this, because that was originally the hypothesis. This was from a bat directly, and by the way, or from a pangolin directly, because there was a part of the virus that had that part in it. Well, the challenge is that the animal markets in Wuhan were being monitored 2.5 years prior to the pandemic.
Mm-hmm.
And with that, they were looking for another different disease, but significantly, they identified a whole host of things that are relevant. They found several intermediate species like palm civets, raccoon dogs.
What is a palm civet?
It's like a cat, except they eat it.
They'll eat anything.
Yeah, and the point here is that there were several species that have been identified as being likely to harbor a virus like SARS-CoV-2. and there was no evidence that that was the case.
Okay.
Number one.
What kind of evidence would you look for?
Well, you'd look for either isolating the virus from the animal, which they tried to do in China. I think they tested over 49,000 animals and found no evidence of a virus in those animals.
Yeah.
And then otherwise, you actually look for antibodies that would say maybe this animal doesn't have the virus, but was exposed to the virus.
Right.
And so
And they just found nothing.
nothing.
Now, is it possible that it was just, the one monkey, like from Outbreak, and that's the one thing you got to
Yeah,
find? Is that
but
ever possible, or would it?
It's possible, but even there, if it was a primate in your case, there should be evidence that some of the earliest human cases would show evidence of primate adaptation.
Mm-hmm.
And so the answer is none. And the viral samples that they identified in the lab market, in the environment where they picked it up from the sewer or from the showcase or whatever, are identical to human cases. So that virus came from a human, not from an animal. And so right there, you're faced with, three pretty strong reasons why. The last reason is kind of an interesting one, and that typically you will find that.
All these reasons, just to be clear, are reasons why it's not an animal.
Well, those would be affirmative criteria if you found, and none of those were found.
Right.
And then the last one is kind of an interesting one because it has to do with animal handlers.
Mm-hmm.
And so the people who actually handle the animals who are susceptible,
you would think they'd be
the first to get it. And by the way, and that was true with the 2003 case with the palm civets, and clearly the case with the camels in the Middle East and Saudi Arabia and Jordan, for example. But in the case of SARS-CoV-2, the only occupational exposure they were able to link to anybody working with anything was a worker in October of 2020. Remember, pandemic started in January, at least officially. In October of 2020, 10 months later, a guy handling frozen fish apparently caught it from a package of frozen fish.
Okay, way later.
Way later.
So that's like the first case in the wet market?
First occupational case of anybody
in a wet market. Yeah.
In any market.
Really? Okay. Wow.
So the point here is...
I thought Wuhan, it's hard to know too. I mean, I don't trust anything the Chinese say.
Well,
so when do we think that they first really detected it? It was obviously before January 2020.
Well, it appears that at least there was some evidence that the disease was circulating in early November of 2019.
Yeah. That's the best evidence best facts I've gotten too. How bad do you think it would have gotten if Trump? I remember debating this so much during that time, and Trump getting so much crap for cutting off travel from China. I even remember the date. It was January 30th.
Yeah,
and I'll just never forget this time in my life. So, what would have happened? How bad do you think it could have gotten if he had never done that?
Well, we got a lot worse faster, number one.
Yeah.
Bought us some time, not a lot, but at least bought us 30 days. But here's a story that probably most of your listeners don't know about.
But getting worse faster is an exponential.
Oh, yeah.
That's an exponential thing. That's not a linear curve. That's an exponent. That's how this works.
Yeah. But one thing your listeners may not be aware of is that back in early November, there were people who didn't recognize that something was going on. And I'll give you two examples. One is, the Taiwanese government. The Taiwanese government realized there was something, a mysterious pneumonia circulating in early November.
Mm-hmm.
And the other group were U.S. diplomats at the U.S. consulate in Wuhan.
Mm-hmm.
And interesting enough that they knew something was going on and notified the embassy in Beijing mid-November. And for some reason that I can't, and we've talked to a lot of people, including one of the two CDC people in the Beijing embassy, they didn't know about it until 30 December.
Yeah, which is just a lie. Or
who's
lying?
The point here is the best we could run it down, and we spoke to consular offices in Wuhan, and we helped repatriate people out of Wuhan, so we were able to actually verify it. They did know something was going on. They did.
Maybe they just downplayed it. Did they just not think it was a big deal, or what's? Common human error, or what is it? I mean, because I don't have a good picture. Maybe paint us a picture the best you can of what was life in Wuhan like at that time. Were they locking people in apartments yet?
No, not yet at that point in time, but there was clearly something afoot. Yeah. And that's where
people were just sick. Was it, did they honestly just not know Is that a fair assessment? I don't know.
Well, I think you can do it by a numbers game, okay? And the numbers game goes like this, which is out of 100 people who get exposed to Wuhan, to SARS-CoV-2, about 50% or 50 will have mild to no symptoms.
Mm-hmm.
The other 50, one will die, 9 others will probably get seriously ill. They'll be in the hospital. And then the remainder of 40 have,
They have the
mild to
flu.
moderate. You
Right.
had a flu.
Yeah, I had that. I had
Right.
the flu, and
Right.
in my memory, I don't remember anything from
Right.
from those like 5 days. It's really weird. I mean, that gets to the strangeness of this particular
Well, and
disease.
that gets to the neurocognitive effects of the
Right.
virus.
Right.
But it does get to the point, though, that until you get to a big enough number, you may not see this thing, particularly if it's something that was would have released or emerged and you didn't know about, it, right?
Mhm.
That you had a leak or something. And so it's plausible that things were going on, things were measurable. For example, Harvard noticed that from social media reporting
Mhm.
and also commercial satellite imaging of hospital parking lots, it appears like parking lots got full by
Yeah,
November.
they knew something was happening.
Something
for
was
sure.
happening.
And then I don't know when they canceled they stopped domestic
Yeah,
flights
I think
too.
it was, I don't remember exactly.
It was earlier, definitely earlier than January.
Yeah, it was like December, if I remember, early December.
And not sure what evidence we have. This is more of an intel community question about their intent to actually cover it up. Although I think it seems obvious at this point.
Well, I think there was clearly, when they figured out something happened, there was no doubt they were covering it up.
Mm-hmm.
The question is when did they really know? And my guess is probably by sometime mid-November.
Yeah.
And we know that from a series of events that happened that would indicate that the government knew something was up, maybe not fully understood how big or bad it may have been, but clearly understood that the Wuhan Institute of Virology was the epicenter for this.
Yeah.
And where they sent a senior official down from the Chinese Academy of Sciences down to the Wuhan Institute, like on the 19th of November.
So is there any steel manning of the argument for zoological origin? I mean, is there any, like, what is this New York Times article? Like, what were they pointing to what are they talking about?
Again, a lot of this stuff is by supposition and inference. Whereas if you look at strict criteria that would say, okay, if it was a dog or a cat, and maybe it was a dog or a cat, let's look with when was that sample taken? Let's look at the sequence of that. And there should be things that honestly the Chinese have not been forthcoming with on many fronts.
For a while, like, there was, again, and I read all the quotes from the news media and everything, and Fauci and all of it. For a while, they were like, look, we've studied the, I don't know, genetic makeup of the disease. I don't know if that's the right word, but we've studied it, and it has all of the indicators of zoological origins. They were so sure of themselves.
Well, I think there's a room for honest disagreement.
Yeah.
And it gets back to how these diseases mix
Mm-hmm.
in nature. So, for example, we talked about that there were no bats or penguins sold in the Wuhan markets.
Mm-hmm.
Why? Because people in Wuhan don't eat bats. That's a delicacy in southern
That's
China.
kind of an important point.
That is
That's
an
kind of
important point, right? And by the way, at the time that this outbreak
Because
happened,
like everybody, that was like assumed for a long time. They
Right.
sell bats there. They eat bats. It's like,
No.
wait, turns out there's actually no bats in the market.
right, that's exactly right.
Jeez.
For 2.5 years prior to the pandemic. So
Yeah.
the other thing is that time of the year, the bats are already hibernating. So the fact is, and by the way, Zheng Lishi, the bat lady herself said, bats in this part of the country, meaning in the areas, environments around Wuhan, don't carry the SARS-related viruses that are related to SARS-CoV-2.
So how did they create SARS-CoV-2?
Well, I'm just going to tell you the parts. This is kind of like parts as parts, but it just relates to the fact that there are different parts of the virus that are from different parts of the viruses that are located geographically disparate areas of China.
Mm-hmm.
So, for example, Southwest China, Yunnan province, is where a lot of the effort and focus has been. This is famously where the Mojang mine is.
Okay.
And we can talk about that if you want a little later on. But I think the point here is that's where principally the bat virus that has been known to be in the possession of the WIV the Wuhan Institute of Virology, RATG is from.
Mhm.
And so that was found in 2013 in proximity to Mojang mine. It was sequenced in 2018, so it was a matter of more recent history, even though the date of its collection was several years earlier. But that's just part of the virus. The other part of the virus is what they call the receptor binding domain. That is the part of the virus that actually attaches to the human cell, particularly in the lung.
Mm.
It's called the ACE2 receptor. And that came from a pangolin in Guangxi province, about 600 kilometers to the east.
Why are these mad scientists going around collecting all of these different aspects from different animals and combining them into this crappy virus?
It's called I call it a virological Russian roulette, right?
Yeah. Like, what's the point? I mean, it gets to the gain of function research and all that. It's like, what's the point of gain of function? Is it really helping humanity in the long run, which is the claim, you know?
Well, when you hear the next part, your head will pop off, I think. But the third part of the virus is part of the spike protein. Remember that little thing that little knob that was out there?
Mm-hmm.
And the receptor binding domain, that the pangolin virus thing is from that. But one part of it is actually from a virus that was found in northeast China,
Mm-hmm.
in Zhejiang province.
So they combine 3 viruses into one super virus.
Parts is parts. And the
For
other,
the sake of science, I guess. Like, what?
well, again, it's just one of these things that I guess it's cool to do. But the point here is, obviously, it's only cool to do if you do it under strict safety
Right.
standards.
So
for
that
which
that gets to what you guys found as far as, okay, so we've had a lot of arguments against zoological origins, mainly that there's just no evidence for it. So what evidence is there that it came from the lab? And,
Well, let me just finish the stories about
Okay.
the 3 bats.
Yeah.
Because here's for your lit audience. How far does a rhinophilus bat fly?
Mm.
It's about 15 to 30 kilometers.
Okay.
And so the distance between miles of where these bats were located is literally thousands of kilometers, if not thousands of miles.
They might as well be in different countries. And
Except that they coincidentally show up in Wuhan, where
Mhm.
people were taking these viruses
Right.
and the bat parts to basically study them.
Mhm.
That's number one. And normally in nature, bats roost together in very tight quarters, and that's where they swap the viruses. They poop and pee on each other, and that's how they transmit them, and then the viruses mix, and that's how it gets done. Haphazard, probabilistically. But here's the point. It didn't happen that way, likely, because these bats are geographically distant.
Mhm.
They happened to occur in Wuhan.
And we know that they're in Wuhan.
They know they're in Wuhan.
That's a fact.
That's
we do
a
know.
fact. That's a fact,
Well,
Jeff.
that's a lot of circumstantial evidence.
I would say that's some, yeah.
And what else? I mean,
And so with that, it's just the whole idea that they were actually doing this viral Russian roulette as a matter of practice
Yeah.
beginning in 2018.
right.
They were literally taking the different parts of the viruses, and again, to evaluate what would be the pandemic potential of this.
Sure. Yeah, they can. Yeah, I mean, that's the whole point of gain of function. It's, I guess, if you're trying to defend it,
Yeah.
they're claiming that you're trying to create the worst case scenario so you know how to defend against it in a lab. But that is Russian roulette, because it's, for the reasons you just stated, it seems highly unlikely that this would happen in nature. So why are you trying to make it happen? Okay, so we know a couple of facts. We know that they did that. We know that they engaged in that kind of research. And then what do we know about their lab practices that maybe help us infer that there was probably an accidental leak?
So first thing we do know is that they did a lot of this work at BSL-2 level. So for the listeners, that's like your dentist's office. People wearing gloves, people wearing masks, a white coat, and they're not doing it under the strict kind of circumstance where if something is what you create an aerosol as a consequence of either mixing, centrifuging, some of these activities, lab activities that actually risk the possibility of kind of making it into a little invisible gas that you can breathe in if you're not wearing a mask correctly, you have a crack in your, whatever it is. That is one thing they were doing. And that's really against what has been standard practice globally. Typically it's BSL-3. That means you're in a safety hood. That means the air is filtered out. You're wearing a mask. You're wearing a lot more protective equipment, and you're being monitored closely. So that was one thing. And by the way, that's not our assessment, though it is, meaning U.S. scientists who witnessed the Chinese doing it. It's reported in published articles by the Chinese. And even Sheng Li Shi, the bat lady, said they were performing this kind of work literally at BSL-2 levels.
Yeah.
And so the possibility of somebody getting infected and not being aware of it immediately would be possible. And this gets back to...
Did we ever find like a patient zero?
No, but we have some ideas about that. And the possibility was identified by the State Department, where they reported that sometime in early November, maybe they call it in the fall of 2019. So you could say October, November of 2019, that some researchers from the WIV became ill with symptoms, including loss of smell, as well as chest X-ray findings that showed these ground glass opacities that would indicate that they likely had COVID.
Right. And so you got a pretty obvious conclusion, because what are the other possibilities, really?
Well, unfortunately, the numbers are long and distinguished, because during our investigation, we identified several things where there were problems. They had problems with autoclaves. These are the pressure cookers that you sterilize infectious waste, that they were not working properly. We found that they were using disinfectants that corroded the laboratory walls and some of the sensitive equipment that increased the likelihood of a leak, for example.
What, going back to gain of function, I mean, again, the other problematic political issue here, and I think why NIH and Fauci were under such strict scrutiny was because of funneling money through EcoHealth Alliance that then went to Wuhan, the Wuhan lab for gain of function research. How should we think about that objectively?
Well, I think the whole point here is that if we had a moratorium nationally, why were we funding it internationally? And right there is one.
Do we have a moratorium?
We did at the time, which was invoked by the Obama administration. But again, the EcoHealth Alliance grant started, literally in 2014 when this moratorium started.
Yeah.
And again, it doesn't explicitly say gain of function, but by the nature of the work that they were planning to do, it was inherently gain of function.
Is there somebody who should be truly at fault for this? I think the anger toward Fauci is that he just denied this so much.
Well,
and it would have been better if he'd just been like, look, we did have good intentions with trying to do this. It didn't go well. That would have been a better response.
Well, the dilemma I see, and so first of all, I don't know how to gauge what his response, other than to say is it's apparent from what I understand from our investigation and some other material I've seen recently, is that NIH generally doesn't know what they're funding.
Yeah, that's a problem.
That's a problem.
Yeah.
And then in particular case where there's the risk of gain of function, either explicitly or implicitly by what is being funded, there was no enhanced oversight. And by the way, there was very little record keeping. So even if there was like an annual report given by the EcoHealth Alliance, the multitude of communication between EcoHealth Alliance and NIH wasn't captured in any formal way so that you could actually make a judgment on this.
Right.
But the point here is that there was probably too much trust in the system, trust of EcoHealth Alliance. EcoHealth Alliance should have somebody on the ground. They didn't. Obviously,
who is EcoHealth Alliance? Like,
well, they were a pastor. They were kind of like a shelter.
Is this like a nonprofit? Like what?
Yeah, they were a non-governmental organization, and what they were doing is basically funding using U.S. dollars.
Yeah, they take grants,
right, and funding this kind of work, collecting these samples in the wild, and then bringing them back and characterizing them, and then again promoting this idea. And this was the whole thing about the DARPA proposal that EcoHealth Alliance submitted, though it wasn't approved, that they were going to, kind of double down on this approach and actually try to expand the intensity of their sampling, as well as the sophistication of the viral Russian roulette that they were going to conduct, without really focusing on the biosafety part. In fact, that's where I think a lot of concern has come up, is that in some ways they played down the issues of the disparity in biosafety levels that the Chinese were using, as well as what the role the Chinese would be playing in that experiment and probably others.
Yeah, and I've talked to doctors who say that gain of function research is it's just not necessary with the modern tools that we have. You can use software to effectively map out these possibilities instead of
Yeah.
actually doing it and again playing roulette with it. One concern right now is H5N1.
Mhm.
How do you view that? Should we be worried about this? And what is it? Like it's a bird flu.
Right.
How should we be thinking about this? How should we be better prepared?
Well, the one thing is that there's a little bit of deja vu all over again, because one of the things that we weren't able to do during the COVID outbreak initially is be able to test widely.
Hmm.
And in some ways, while H5N1 currently, where it affects seals, it affects obviously poultry, it affects cows, and there have been a few handful of cases in humans, we probably just need to have a better understanding or monitoring of what the situation is. So better situational awareness, like what's going on in animals,
Mm-hmm.
what's going on in humans. And we haven't quite struck, I think, the right balance to do that. And so ultimately what you want to think about is, and I'll make the comparison with COVID. COVID came out of the lab or the bottle or the bat, highly adapted to humans.
Mm-hmm.
And with that, it came part of the door, literally.
Mm-hmm.
This case is that you have sputtering or these jumps where the virus is jumping from an animal to a human and not affecting the human to the point where they can infect another human.
Yeah.
That's the critical juncture right there, where it becomes adapted to the human and then adapted for human to human transmission.
Mm-hmm.
We need to have better situational awareness of that. And we're not doing that. That's a relative.
How do we do it?
Well, I mean, it's like you well, I'll tell you how you do it practically is you go to a clinic or a clinic in the area where an outbreak is and where people coming in for a variety of illnesses, you pull their samples, right?
Mm-hmm.
You put it all in one tube, and then you test the tube and see, hey, is there any evidence of H5N1 in that?
So we're not like, whose job is that?
Well, I mean, it's a role for CDC, it's a role for USDA, and they got to work together. It's the, lion sleeping with the lamb kind of scenario here sometimes. But I think the point here is that, CDC has not reconciled how they're going to do this in the future. The way it was done ultimately in COVID was it was less CDC and more the companies that actually do diagnostic testing, because that's what they do all the time.
Yeah.
And it's bigger than the public health laboratory. So even though they're very important. And so in some ways, you're going to have to basically get everybody to the table again and saying, hey, let's start looking for this. And when we do find it, then we have to take another strategy to be more directed.
It's the biosurveillance.
Right.
I mean, we did this on our committee with the
and you,
reforms.
by the way, not congratulations yet, but thanks for doing what you're doing in that space.
Yeah.
Because that is critical in terms of not in the situation of H5N1, but any other future pathogen we may.
Right. Everything we passed, committee and Colin will have to remind me where this stuff is in the legislative process, but biosurveillance, fecal matter surveillance is kind of an easy button to press.
Right.
You don't
Sewage,
have to test people, you can test sewage. It's just not clear to me that anybody's doing it. This is something I brought up with the CDC is the American people believe the CDC is an operational unit. Instead, it's sort of this academic unit, which is exactly what it shouldn't be. We imagine it like we see it in the movies,
right?
Where something happens and you've got a team ready to go out, do testing, you know what you're talking about. That's just not the reality.
Yep.
If it needs to be, what the hell is the point of the CDC? Instead they're doing like studies on gun control. I'm like, what the hell? And so that is something I think there's some bipartisan agreement to that, but
and I think that's the kind of stuff that you need is, and by the way, a lot of this stuff doesn't exist in the government. Again, I served in the government, probably more than I'd ever like to think about, but the point here, a lot of this resides in academic, centers.
Mm-hmm.
Texas got a lot of great ones, A&M for one.
But nobody is operationalizing all that into like everybody needs to think about this. And
right. And their companies are doing this routinely for animals and for people. And this is kind of like almost a no-brainer. But if CDC feels like they own it and they're the only ones who can do it and who are smart enough and good enough to do it, then here we are. We're in a position where we don't have the situational awareness that we need. at
Yeah.
a time when it only makes sense.
Or should it be the organization you came from, ASPR? Like what?
Well,
Maybe explain in Civics 101 the difference between.
yeah, I think, ASPR was more of an operational unit because we were actually employing strategic national stockpile. We were developing vaccines. We were deploying medical teams for treatment, not for surveillance. And so in some ways that's more in the DNA of ASPR, but clearly in a world, and I use a defense analogy, you'd like a NORAD-like entity that would help define where the missile's coming from, what kind of missile it is, what the payload, and ideally that would be CDC. But the fact is they got to recognize and accept that they don't have the wherewithal, meaning the people and the access to the samples and to the laboratories, all the laboratories in the country. If they were able to do that, they could be that NORAD.
Yeah.
But they ain't that NORAD.
No, they're not. But what is it they do?
Well, they read a lot of studies.
Yeah. They could
after the fact.
Yeah, after the fact, and that's great. But it's like we can rely on academic institutions to do that. That shouldn't necessarily be housed at the CDC, or it shouldn't exclusively be their role.
But to your point, we do need a strong entity like the CDC to do those things, to be able to be on the watch.
Yeah, you got to be. We need Dustin Hoffman and Outbreak. Who are the people who go to the town and actually right?
Muddy boots, kick down doors.
Yeah,
really.
No, we're not kicking down any doors.
Just kidding.
But yeah, you still need somebody who's actually on the ground, and we just never had it, and it doesn't seem like we're learning lessons. I mean, we're still debating over whether lockdowns were a good idea. I'm clearly on one side of that debate, always have been, but the sad, I'll say this in conclusion. I mean, the sad thing about all of this is a lot of trust was lost with your public health experts, and for good reason. When I explain to people why are people mad at Fauci? And I think it's because he constantly made absolutist statements that required a lot more nuance and basically treated the public like they were stupid. And, and just again, came out so strongly against things like a lab leak theory or the use of alternative medicines like, ivermectin. And I don't know if ivermectin works or not, but I also know it's not very harmful to you. So, you lost a ton of trust that way. The masking, the lockdowns, like the 6 feet, where did the 6 feet rule come? Nobody really knows. It just made it up. And I think so much trust was lost. And the dangerous part about that is the next virus, maybe you do need to lock down. Maybe it is that bad. Maybe it is a lot more than like a 0.1% death rate. Maybe it does kill children, but the public doesn't trust you anymore. That's really dangerous.
No, I don't. I agree with you entirely on that. And that's the hardest thing to regain is trust, as you know.
Well, we hope to. If we had more Dr. Kadlec, maybe we would. So I appreciate your work on this and, bringing this to light. And it's enlightening for our audience. So thank you.
My pleasure. Thank you.